proper handling. So,
You're yellow. I think so. Oh, this is great. I can get it.
Thank you, Jack.
All right, so my presentation is on specimen handling. Don't laugh. So I'm gonna tell you at least what I know about it. So if a patient were to come in and have like a lesion removed or something that needs to be sent out, first and foremost, like in the chart, most of the time, from what I've seen, there's always gonna be like one of the lab slips from wherever it's gonna be sent. So, like this is one for like Christiana, for example, another Christiana one for like a culture, and then St. Francis. It should have like a patient sticker on both copies, so like the yellow copy and the white copy will have a sticker of the patient's information. The pre-op diagnosis like will be filled with like the ICD-10 code will be on there also pre-filled out, and then you would check if it's like routine. Who the ordering physician is would be filled out. Most of the time, if not, fill it out. And then copies would be whoever like their primary care doctor is, which you will see that on like the demographic sheet, which will also be in the patient's chart, and you will also send it with the lab slip. So once the specimen is obtained from the scrub tech, you will then have one of the little specimen cups, like formalin, for example, or if it's sent like fresh, then you would get like a specimen cup, depending on how it's sent. You would get the patient sticker. On the patient sticker, put what the specimen is, so you will confirm with the surgeon what the name or what they want to call the specific specimen that they're going to send, and confirm it. The circular then would obtain the specimen from the scrub tech with gloves on to make sure that they don't get like the material on themselves. Formalin. On themselves. And then you would confirm also like with them like the patient name, date of birth, make sure the information's correct. We would then seal it off, and also fill out like what the specimen is on the designated like form. Once you do that, you will then put it in one of these specimen bags with the form and the demographic sheet. Once you obtain all specimens that you need at the end, you will then take it to the designated book. So like there's a book for each place. So like this is like the St. Francis one, for example, or the Christiana one. So I did the Christiana one mainly. For the Christiana one, you would get like a stick, one of these stickers. So the big sticker would go to the big bag here. You would put it on there, which would be where like you would obtain all the specimens that you get at the end of the day for any OR together once everything's verified. And then the small sticker would be for the one that you're going to be sending for the day. So you would place it on here.
And that's for the start of the day, correct?
For the start of the day,
Yep.
yes. For the start of the day. And then you would put the date, the patient's last name first, and then first name, who the doctor was, what the specimen is, and make sure that it matches what the name is on what it's labeled as on the specimen cup. You would check to make sure that the specimen's been obtained and the forms have been filled out correctly and that the tissue is in the jar. And then the collecting nurse who obtained the specimen would put their initials here. Then they would leave it, like the book would stay open, they would leave it basically on the book inside like the smaller bag that it goes in. And then another nurse would basically come and sign here and double check that everything is correct and that we have everything that we need for the specimen. Once that's done, then it'll stay there at the end of the day, and at the end of the day, I want to say it's Amber, the one who comes in.
Often Amber will ask someone to come and get the
To
specimens.
come and bring it up, yes, and then they will, with the book, and then she will initial it at the end to make sure everything's correct. And then it's pretty much the same for, like, this is a St. Francis one, except the St. Francis one doesn't have like this sticker. So same thing, date, patient's name, doctor, what the specimen is, and the two nurses to check it, make sure everything's in there, and then Amber will take it up to the front.
One more thing.
One more.
Yeah.
For fresh specimens.
This is a fresh. It's red, clear as day. Do not send United Healthcare to Christiana. Pretty clear as day there. And then for the fresh, you would do, put the patient sticker here with the date, the doctor, what the specimen is, and the same thing you're gonna verify, in the initials. And then for this, I know we call, or for this one is when we call to have someone come in.
If we know we're gonna have a fresh, Amber will estimate the time and she'll call them and give them a time. If it's a fresh specimen that's unexpected, she'll call Christiana, let them know, and give them a time for pickup.
I will say I haven't done a fresh one yet.
So where do we send United Healthcare?
Stop it, Gary.
I don't know.
St. Francis. St. Francis.
I don't know.
I don't know. That's a good
That's
your other
question.
choice, so.
Oh, well then, yeah, your other choice, let's say St. Francis.
For fresh? I don't know about that.
I don't know about that.
Yeah.
Oh, for fresh, I thought you meant just specimens in
We've
general.
always
I
said
thought
fresh to
just-
Christiana.
I thought just.
No, I thought you was just saying like, a specimen, yeah, specimens in general.
United Healthcare probably can't go to,
Frozen section.
so we're gonna have to find out. It's a good question.
Where United Healthcare.
Mhm.
Any
Very
questions?
good.
But we're gonna go over, frozen sections too, we use those, but not very often. Not
Okay.
very often. So,
Okay.
someone from St. Francis will come, and they'll be in that little room down there, what's it called?
Allied,
Allied Health Room.
Next to the peanut butter.
Right, there you go.
Next to the peanut butter.
And so on this sheet, you'll fill it out and you'll write fresh, pretty big on there is what I do. And you write down, what the specimen is, and then you put your location so that they can call you, because the tech down there is gonna wanna speak to the surgeon to let them know whether they need more margins or, you know, more pieces, so. We put the extension number on there, and then they'll just call in.
Jane has that phone, they don't have.
I know, yeah, it's just the number will be different, they have a phone number.
Oh, they do?
So that way they can call in when they're ready to talk to the doctor, and sometimes you'll have to take another piece, and usually you'll put it in the same book, in the, St. Francis book, and the tech will take all of it. So you don't really like do the traditional way of sending the specimen if it's frozen, because the tech is down there and they'll take it with them back to the hospital, so.
And you can't bring the patient back until you know they're here.
Yes, that's really important.
Amber usually calls in to tell you, or you know, to just say,
So you
hey,
know
have they arrived yet?
who's here.
and it's usually Dr. Warren. It's usually Warren.
Pathologists.
Yeah, Dr. Warren is the one that does these cases.
Lauren will do them again.
Thank you.
All right.
Any questions?
Thank you.
Okay, thank you.